Welcome to Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black South Florida community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
Greetings. Thank you so much for joining us, and welcome to Black Health, a platform to discuss health issues affecting the Black community. I am your host, Dr. Michelle Kirwan Blythewood. I'm a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens. Today, we embark on a fascinating journey as we explore the science and expert insights behind the ultimate act of self-care, sleep. If you've ever wondered how those hours of shut-eye impact your physical health, mental acuity, and overall vitality, you are in the right place. Get ready to transform your nights and supercharge your days with our deep dive into the world of sleep on Black Health. And to guide us on this journey, we are joined by Dr. Azizi Seixas. Welcome to the show, Dr. Seixas.
Oh, thank you so much for having me. I'm very delighted. Yes, thanks for having me.
Absolutely. I'm going to take a brief moment to introduce you. Dr. Seixas is the Associate Director of the Center for Translational Sleep and Circadian Sciences at the University of Miami Miller School of Medicine. He is a sleep and circadian sciences expert. He specifically focuses research on why sleep problems are common among minority communities and how racial and ethnic disparities in sleep quality and quantity have major health consequences. So Dr. Seixas, let's start off with what is translational sleep medicine? That is your specialty, correct?
Well, thanks again for having me. Well, translational sleep health medicine really speaks to this idea that it's not just trying to understand the basics and the science of sleep, but how sleep impacts our daily lives and our health. I think you mentioned it, that sleep really is a fundamental health behavior. We believe that sleep is one of the most foundational things that we can do. It's the body's way in which it can cure itself, it can heal itself, and it's the only way it can do so almost unconsciously, so to speak. Mm-hmm. And so this is why translational sleep is important, because it's not just understanding the basics of sleep and the science behind it, but how we can translate this and apply it to everyday aspects of our lives, because it impacts so many different components of our well-being as well as everydayness.
Yeah. Sleep is so important, and I think it to health, like you stated, and I think it's something that we just don't think enough about when we talk about our average everyday health as well as more significant health issues. So you also are an expert in circadian rhythms. Explain what circadian rhythms are and the significance of them in sleep. I don't know if majority of people watching know what that is. What a circadian rhythm is.
Sure. Thanks for the opportunity to clarify these, because oftentimes people use sleep and circadian interchangeably and they're not the same. And so what we do know is that if you look at your entire 24-hour day cycle, that about a third of that should really be spent sleeping. So about 8 hours or so. And so what happens the other 2/3? Well, it means this is the time when we're active, when we're eating, we're, doing our daily chores or doing daily activities. And so there are some key, biological processes that occur throughout those 24 hours. And all of those things occur automatically. We don't have to think consciously to breathe. We don't have to think consciously to digest our foods. All those happen automatically and they operate on clockwork. So typically around 6 p.m., 7 p.m. in the evening, people may feel hungrier. Why is that so? It's not that your brain is necessarily focused on eating, but there are clocks and, biological clocks in our gut, in our digestive system that starts to send signals and communicates with different parts of our bodies, like our brain, to say, hey, I am feeling hungry and I need to get some more food. And that operates like a clockwork. So we have these multiple biological clocks throughout our entire bodies, our tissues, our cells, and they all work in harmony, just like a symphony. And your circadian biology, your circadian rhythms operating that way. And that's what makes the human being so majestic and so beautiful and powerful. And so sleep, if you were to connect the circadian component and the sleep, what that means is that there is a time in which you get tired and you must rest. And so this is why we oftentimes push this idea that your body is the best determining factor to tell you when you should sleep. And so you need to take heed of that.
I know sleep is our topic, but I'm going to step aside and I'm going to thank you for stating that so I can explain now to my husband why my constant voracious appetite is not my fault. It's due to my circadian rhythms.
Certainly.
So, Doctor, you also specialize in in minority health in terms of sleep health. So, does poor sleep quality disproportionately affect minority communities, and if so, why is that?
Unfortunately, it does, and there have been several population-based epidemiological studies as well as clinical studies that have borne the very grim reality that African Americans, as well as Latino, as well as Native American and Pacific Islanders, and some Asian groups, actually suffer the greater burden of poor sleep health. That could be in terms of they get less sleep during a particular day. They may be more burdened by sleep disorders like obstructive sleep apnea, which is a sleep breathing disorder, or insomnia, or other host of different sleep disorders. And so that's the grim reality. The question then is, why is that so? We still have some sense, but this is why many of us are trying to understand, why is it that these individuals seem to be more at greater risk? So one area is to tackle it from a biological standpoint, and some have looked at that, and there hasn't been any conclusive evidence that suggests that the biological makeup of these racial ethnic groups are so vastly different that would cause them to have different sleep outcomes. What we are seeing more evidence for is the fact that there are some social factors, there are some stressors, there are some historical exposures to, whether it be discrimination or not having access to certain, things like food or proper housing, or living in certain neighborhoods, that make it harder for people to get the required amount of sleep. And so that's primarily the reason why. And that in many ways can have some really bad consequences that may explain some of the differential health outcomes that we see in heart disease, as well as other forms of health conditions like diabetes and stroke and the like. So what I just shared with you was an explanation about what might be the drivers for differential outcomes or differential sleep patterns across racial ethnic groups. And it seems as if biology may not be the answer, but more so the social, environmental factors. And then I explained to you what might be the causes of these poor sleep outcomes, because they can have significant health consequences.
Yes, and we're going to dive into those health consequences a little bit later on the show. Are there specific sleep disorders that disproportionately affect minority individuals?
Yeah, no, it's an amazing question, and there are two that primarily jump out. One is obstructive sleep apnea, which is a sleep breathing disorder, and essentially what this is characterized by is that someone is asleep and trying to fall asleep. Unfortunately, there is this blockage, whether it be partial or full blockage of airflow while sleeping. And as a reflex, to get more air going into the body, because typically what happens is that the body is then starved of oxygen, that the body wakes itself up repeatedly. And someone can go through these episodes multiple times, especially if it's untreated. Thankfully, there are treatments for obstructive sleep apnea, like a CPAP machine, as well as some others, depending on, the severity of your condition and, your candidacy as well, because there are different profiles of patients that it works for. In terms of insomnia is the
Dr. Seixas,
yes, sorry.
I'm going to interrupt you 1 second. I'm going to put a pin right there because we do need to take a commercial break. So you talked about obstructive sleep apnea. Right after the break, we will resume where you were with insomnia. So give us
Sure.
1 second. We will be right back on Black Health. Don't go anywhere. We are talking about sleep with Dr. Azizi Seixas. We'll be right back.
Miami-Dade Transit's Better Bus Network is shifting into gear. This community-led effort creates better access and an improved rider experience with less wait times and more reliable service. The new network provides more frequent and faster trips to more parts of the county, increasing transit access to jobs, education, healthcare, and quality of life. Learn about the new routes and new connections by visiting miamidade.gov/betterbus.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, your accident attorneys.com.
It's time to find a health plan that can keep up with your life. A plan that makes getting care convenient, with doctors around the corner.
I can get used to that.
Plus, 24/7 access to care. Plans that keep more money in your pocket, with plan payments as low as $0.
$0. Looks good to me.
Let's find your health solution. Click to speak to a dedicated Florida Blue agent today.
Welcome back to Black Health. We are talking about sleep and sleep disorders, how these affect minority communities, especially with Dr. Azizi Seixas. The question was, are there specific sleep disorders that affect minority individuals more commonly? You just spoke about obstructive sleep apnea, and you were going into the second one. Go ahead.
Sure. Yes. The second one is insomnia. And insomnia is characterized by 3 symptoms. These include problems falling asleep, problems staying asleep, and early morning awakenings where someone wakes up involuntarily and they're unable to head back to sleep. And so those are the 2 primary sleep disorders that we see disproportionately affecting racial ethnic minorities.
Okay. Are there cultural or lifestyle practices that impact sleep with minority communities?
It's a good question. I think what I would say is that there are some cultural beliefs and attitudes that may be a little bit, ungrounded. So, for example, there are many people, and we've done community-based work, and we oftentimes ask the community, "What do you think is a good indicator of good sleep?" And 9 times out of 10, they'll say the person is snoring, and that's indicative of deep sleep. And we're not saying that all snoring is bad per se, but what it might indicate is that it is maybe a classic sign of a obstructive sleep apnea, which I mentioned previously. So that's one area that I wanted to bring some awareness about, especially if the person seems to be unconscious when they are snoring, or they stop, seem as if they're stopped breathing. I would be very mindful of that. I think there's also culturally, and it doesn't just pertain to racial ethnic minorities, but I think globally, in this very fast-paced world, that everyone needs to be available now. And so what that lends itself to is heightened degrees of stress, and therefore heightened degrees of stress can significantly impact your ability to sleep, and it's been linked to insomnia-like symptoms as well. And so those are the 2 areas, where there are some classic symptoms that are, associated with sleep disorders that people aren't aware of. And there's just cultural beliefs and attitudes, sometimes not appropriate, not grounded, where people need to better understand that stress is really the worst factor that it can impact your sleep.
Okay. You mentioned earlier, you talked briefly about various health conditions that are impacted by sleep quality. You mentioned minorities have higher disparities in sleep disorders. We also know that minorities, people of color, have higher disparities in things like hypertension, cardiovascular disease, diabetes. So talk to me about the intersection between these health issues, conditions, and sleep quality, especially
minorities. Sorry, my apologies. Now, thank you so much for asking that question because, what we can say is that there has been mounting significant evidence for this. This is why a year or two ago, the American Heart Association included sleep as its eighth pillar for good health. Why? Because we have amassed, decades of data to show that people who don't get adequate sleep or people who have untreated sleep disorders, that they have an increased risk for hypertension and particularly resistant hypertension. For the individuals who may be on an antihypertensive medication and for some reason it's just not working. And what we have found in our work clinically as well is that these individuals may actually have untreated obstructive sleep apnea. We have done work looking at poor sleep and obstructive sleep apnea and stroke risk. We have looked at short sleep and stroke risk. We've looked at sleep and diabetes. We've looked at sleep and heart attack likelihood and poor mental health and cancer, as well as injuries and obesity and the like. So it goes to show that there is mounting evidence, not just for adults, but we're seeing it with kids as well from a mental health standpoint, whether it be kids who may have some form of hyperactivity. That these are the kids oftentimes that may be sleep deprived. And so what I'm showing is that there's been significant links with sleep. The work that we're doing now that is showing some promising work is the link between sleep and Alzheimer's disease and dementia. And so those are the areas in which poor sleep can lead to a whole host of poor health outcomes. And equip, physicians, providers with the necessary tools to screen people well, to detect if there might be some underlying sleep issues, and then provide pathways in which they can be referred to a qualified sleep specialist. So you're absolutely right. And so, we've done some work educating primary docs, so people who provide primary care. We're trying to do so amongst treatment teams as well. I think what I would suggest is the American Academy of Sleep Medicine, as well as the National Sleep Foundation, have a wealth of resources that physicians can tap into. And so you can do so. There are some, sleep questionnaire surveys that are very short that can be administered by treatment teams. I am happy to reach out to them or have them reach out to me and our group, because that's kind of what we are doing. And it will take some time, because I know as providers, the worst thing that you want to do is to ask a question and not point the patient to a solution. And so this is where we can work with those individuals to provide that level of support. But they can go to the American Academy of Sleep Medicine, as well as the National Sleep Foundation. There are other foundations that are well equipped, but the American Academy of Sleep Medicine is one of the primary governing, professional societies on sleep medicine in the United States and globally as well.
Good to know. Those are great resources.
Yes.
Going back to health conditions and disparities, what about sleep in the role of memory consolidation and cognitive function? You talked a little bit about Alzheimer's and also sleep and mental health.
Those are
in about 1 minute before we have to go to commercial break. We'll split it up. Go ahead.
No problem. Tons of linkage between that. Anyone can feel the immediate effects of that. If you don't get good sleep or you're sleep deprived the next day, cognitively, your concentration, your attention seems off. Your inability to remember things is compromised. And so those are some key areas that we know, and there's tons of evidence showing that. So people need to be mindful of that.
Mm-hmm. And Alzheimer's. So I think you're speaking more short term. The next day, you're not thinking well. Long term mental health, I imagine, is depression, anxiety, and I'm guessing Alzheimer's and cognitive decline.
No, thank you for that. I think the question of Alzheimer's is more along the lines of cognitive functioning. The issue around mental illness is slightly different, because there seems to be this circular relationship whereby people who are depressed are more likely to be sleep deprived. But when you're sleep deprived, it can actually cause significant depressive-like symptoms. So it's a circular relationship. With
Yeah.
Alzheimer's, it's more so untreated sleep problems as well as poor sleep over time. What we do know is that sleep is important for significant clearance systems in your brain. So there are there's debris in your brain that needs to be cleared out each day. And it only does that through sleep. And it does so most optimally when you sleep. And so if you're not getting sufficient sleep, these debris actually accumulate over time that can cause significant brain health issues.
Wow. Thank you. And you did all of that in perfect timing. We are now going to take a commercial break. Don't go anywhere. Don't go to sleep. We will be right back with more on sleep with Dr. Azizi Seixas. Thank you, Dr. Seixas. We'll be right back. Join us more on Black Health.
Miami-Dade Transit's Better Bus Network is shifting into gear. This community-led effort creates better access and an improved rider experience with less wait times and more reliable service. The new network provides more frequent and faster trips to more parts of the county, increasing transit access to jobs, education, healthcare, and quality of life. Learn about the new routes and new connections by visiting miamidade.gov/betterbus.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm.
Time to find a health plan that can keep up with your life. A plan that makes getting care convenient, with doctors around the corner.
I can get used to that.
Plus, 24/7 access to care. Plans that keep more money in your pocket, with plan payments as low as $0.
$0. Looks good to me.
Let's find your health solution. Click to speak to a dedicated Florida Blue agent today.
Welcome back to Black Health. We are talking about all things sleep with Dr. Azizi Seixas. We only have a few minutes left, Doctor. I really want to give the audience just a few quick nuggets. So just rapid fire your suggestions or recommendations, I should say, in terms of sleep for diet, foods to avoid, foods that are good, timing of eating prior to sleeping. What quick thing in a nutshell would you give there?
Yeah, so we, on our website, and on my website, I have a 21 tips of getting good sleep hygiene, so people can certainly go to that. But some key things that people need to be aware of: try to avoid mobile devices that emit blue light that can significantly impact your sleep. So that's one thing. You want to avoid eating heavy meals close to bedtime. Try to avoid exercising too close to bedtime. Try to avoid stressful situations as well. And so that's where I believe that I think that's where I believe you can certainly add some significant impact and value to your life as well. And try to make your bedroom environment one that is conducive to good sleep. So setting the temperature a little bit cooler, 67, 68 degrees if you can afford to do so, and ensure that it's quiet, dark. And if you're having difficulties falling asleep, a nice warm decaffeinated tea can help, as well as some people may listen to those audiobooks that can help you to soothe yourself and to fall asleep. Try to limit the amount of time that you actually read. If you're one of those readers before you go to bed, it can actually activate you. So there's several of those tips that I would highly recommend to folks.
How about for people like me who wake up in the middle of the night? I wake up at 4 o'clock in the morning, many a night, and have difficulty falling back to sleep. Although I have learned to not sit and think about work and the things I need to do, I immediately pop in some earphones and I start listening to something, a meditation or even an audiobook or something that helps me actually go back to sleep rather quickly. But what would you recommend?
Yeah, that's a good point. I think, I have to be very careful here because, those signs might indicate something differently for others. So I just want to be mindful of that I don't give this one size fits all. Mm-hmm. But generally, just to soothe the person, I think what you did, what you have done, and what you do is highly recommended as well. I know some people try to figure out what works for you, and I would really have people diary and take a journal as to what might be causing you for waking up. Maybe you went to bed very stressed. Some people may have some difficulties. They may have to go to the bathroom to use, the restroom, and as a result of that, when they're awake, they're unable to go back. So maybe what I would do, and we've done this with folks, is to use a bathroom several times before you go to bed so that you don't have to wake up as well. So there are different ways in which you can address that, but try to make sure it's nice, calm, tranquil, as well as peaceful. Try not to think about it too much, because that can build up a lot of anxiety around it. And if you're in bed and you're having difficulties falling asleep, just get out of the bed, clear the space. If you have the ability to go elsewhere, but try not to just stay in bed tossing and turning, because that can, cause even more anxiety about falling asleep.
Well, you're going to have to end on that note, Dr. Seixas. Thank you so much. There's so much more that we could talk about regarding sleep. So maybe we could have you back for another show and we can continue this conversation. Until then, many thanks to you, Dr. Seixas, our guiding star in the realm of sleep. Your insights have enriched our understanding of the vital link between sleep and well-being, and have also likely inspired our listeners to prioritize their nightly rest. Quickly tell us where we can find you.
Sure. azizi.seixas@med.miami.edu. I have a website as well, Dr. Azizi Seixas, or you can find me at the University of Miami Miller School of Medicine, and you can always email me. Happy to entertain any questions. So thank you so much, Dr. Kern, for the opportunity. We see this as a labor of love. We want to get the word out, and thank you so much for all the great work that you are doing, and thanks for the opportunity to share this.
Absolutely. Thank you. Thank you, University of Miami, for letting us borrow Dr. Seixas for a few hours out of, I know it is a very busy day. You can find me, you can follow me on Instagram at Black Health Show, and we will be back with more Black Health another time. Until then, have a great day, everybody. Take care. Bye.